The Miseducation of America's Nurse Practitioners is a damaging article that questions the quality of nurse practitioner education and practice in the United States. This is my initial opinion on this article and will follow up with a more in-depth commentary. I am unclear on what motivated this criticism or what the purpose of this dissemination of potentially misinformation against nurse practitioners hopes to accomplish. It highlights concerns about inadequate training and the increasing independence of nurse practitioners in treating patients, including in specialty practices and emergency rooms. Critics argue that some nurse practitioners may lack sufficient experience, particularly those who transition directly from high school to advanced degrees without substantial clinical practice. I don't completely disagree, but nurse practitioners are required to complete a bachelor's degree in nursing, which includes several years of clinical training and the passing of the NCLEX before getting their nursing license. In response, organizations like the American Association of Nurse Practitioners defend nurse practitioners, emphasizing their rigorous training, certification, and significant contributions to healthcare. Critics argue that some nurse practitioners may lack sufficient experience, particularly those who transition directly from high school to advanced degrees without substantial clinical practice. As far as I know, there are no nurse practitioners that start practicing straight out of high school. There are at least 5 to 6 years of advanced education before any provider is managing a patient. In response, organizations like the American Association of Nurse Practitioners defend nurse practitioners, emphasizing their rigorous training, certification, and significant contributions to healthcare. This does nothing to the reality of the current broken healthcare system where, among other issues, it is woefully lacking in providers to meet ever-increasing patient needs. As a 30-year clinically focused nurse practitioner, I also worry about any fast-tracking of providers that fails to ensure appropriate training and transition to practice programs. All nurse practitioner graduates, similar to nursing graduates, have completed significant clinical rotations and must pass a national certification exam to obtain their state CRNP license before entering practice.